I'm Dr. James Laporta. I'd like to take you through a few common cancer myths, some things out there that are maybe misunderstood or some questions that may be floating around your head. I know that there are a lot of treatments out there and there's a lot of different practitioners and a lot of different patients and personalities and people that claim and sing from the rooftops certain miracle cures and other people that genuinely have found something that have been of value and of interest. Perhaps if I can choose the top 3 or 4 cancer myths: diet, chemotherapy, cannabis, and this palliative care where you have hope first denial. Okay, let's start. Let's talk about diet. There are so many diets out there. I'm sure you've heard of paleo diet and ketogenic diet and Gerson diet and the hay diet and the blood group diet, an alkaline diet, vegan diets, and the list goes on. And a lot of people are looking to cure cancer with natural smoothies, raw food, and just eating a very healthy kind of diet. Sometimes makes them a lot healthier, sometimes it can really damage you. You know, can you imagine having a very advanced stage of cancer where you're losing weight rapidly, you're on several strong medicines and many supplements, and you need kilojoules, you need nutrition, you need nourishment. Your body hasn't got the energy or reserves to digest these raw foods. On the other hand, in a case like that, you need good supportive stews and broths and things that can really nourish you. The old mom's tales and foods and things like that that can really spark the body to just be held and supported during intensive treatment. In very early stages, where you're looking at a small bit of tumor growth or precancerous growth, or similarly in an area after cancer where you want to maintain health and create an ultimate healthy environment so cancer doesn't come back, there you can certainly look at strong antioxidants, good healthy raw foods, good diet, superfoods, all sorts of extracts, and you can let medicine be thy food. Absolutely. But as we said, in very advanced or aggressive cancer states, you need a little bit more to get on top of that cancer first. If we look more specifically at some of the dietary myths that are out there, let's talk about alkaline diet. So yes, if your body's in an alkaline state, it certainly functions better, your immune system functions. We know that cancer lives in an acidic, high-pressured, hypoxic environment that is very difficult for the immune cells to get to or for enzymes to function properly, and this causes more aberrant DNA growth and mutations, and we understand that. But the alkalinity is not formed just by what you eat. Your stomach's acid. If you eat alkaline foods or acid foods, the acid just neutralizes it. The more acid you eat, like lemon, can actually increase secretions of pancreatic juices and digestive enzymes from the bile duct, and suddenly you have a more alkaline absorption and system. So it gets a bit tricky when you just rely on food group. And furthermore, if you're stressed or you're anxious about something, these high cortisol stress hormones can change the milieu around the tumor and can certainly change the way hormones and enzymes operate. That causes more acidity, lactic acid buildup or cortisol stress responses. All of these things, inflammation, all of these things actually cause acidity and change things. So you can't really change the environment of the tumor solely by diet. And the problem is people become so fixated on a hardcore alkaline diet that they barely enjoy their food. They become a little more depressed. They lack energy. In some cases, if you believe it and you enjoy an alkaline diet, it's an option for you, absolutely. But in other cases, it's certainly not a master cure. If we look at something like, we won't talk about the Gerson diet or the hay diet, a few things like the paleo diet can be really helpful. I've just found a lot of people undernourished by the paleo diet. Ketogenic diet, it can help in certain cases, and certainly where you've got metabolic syndrome or obesity or associated seizures, but there's always sugar in your body. Every single cell is able to absorb sugar. There's certain GLUT4 and GLUT1 receptors in cancer cells, and they contain more receptors that absorb sugar via a different pathway. So even when you're ketogenic, they still have access to the sugar that circulates. You need sugar for health. Every cell needs sugar. Sugar's not the enemy like we think it is. It's the overdose of sugar in our diet that's the enemy. So a ketogenic diet has certain functions, but ketones themselves are not the strongest cancer killer. The ketogenic diet can be so stressful. It's hard to stay ketogenic. So a lot of the times people fluctuate between in ketosis, out, and that really stresses the body. If you're happy on a ketogenic diet and you're testing your ketones and you find it works for you, sure, 2-3 months of that might be good. Any longer, you start auto-intoxicating and eating up your own cells in a way beyond just the toxins and the fats. And I think you should be quite cautious with ketogenic diet. May be appropriate, but explore it a little bit more. I was mentioning the sugar, so let's talk about sugar. If you take a healthy diet of someone who has some muesli in the morning with a nice sweetened fruit juice or just an orange juice you buy from the shops and some yogurt, which has tons of sugar in it, normal yogurt, you're probably having around 35 to 40 teaspoons of sugar in that breakfast. If it's a large helping, up to 60-70 teaspoons of sugar. Then you move on and you have some salad dressing, or you have a salad and you have something else sweet next to it, or just the natural carbohydrates or fruit salad. That's all right, but again, you're adding on another 15 teaspoons or so for the fruit salad. And you might have a snack later, and then you might have some nice sweetened stew or something that is got sugar in it that you didn't even know exists. So it's a healthy meal. You've had almost 80 to 100 teaspoons of sugar in a day. I follow people's healthy diets. It is phenomenal how much sugar excess there is. It's like a drug war. It's the cartel of sugar. So yes, of course, that kind of sugar overload is going to speed up cancer cells, which are far more metabolically active. They need food. They need to get that. High sugar levels cause increased stress hormones. High sugar levels cause all sorts of damages and advanced glycosylation end products and disturb blood flow. Sugar like that can give the tumor everything it needs to metabolize much quicker. A little bit of natural sugar, a little bit of honey, something that's found in some of the good fruits, that's absolutely fine. Don't avoid sugar. Your body needs sugar to survive. But the right kinds and certainly reduced amounts. Another type of diet we can address is vegan diets or meat-free. So meat's an interesting thing. On one hand, if you've got spiritual beliefs or other reasons to not eat meat, we respect that, and that's a different reason for being vegan, and you need to follow that because that's your passion and belief system, and it'll feed you in the right way. Make sure you get enough roughage and make sure you get enough vegetable proteins in a combination and a variety of colors and food groups. If you're not vegan and you choose to eat meats aren't bad themselves. Actually, the kind of protein you get, the density of protein in something like lamb with the natural fats, that is absolutely brilliant in a stew or cooked up as a bone broth. It can support your bone marrow and production of immune cells immensely. It can give you energy. I've seen people in a very lethargic and weakened state that start having bone broths and good nourishing food and change to a mixture of carbohydrates that are slow release and some good types of meats, and they thrive. For the right kind of person in the right kind of state. The quality of meat is very important. If you have wild caught salmon, for instance, or small open ocean caught sardines free from heavy metals, much better. If you have grass-fed meats or organic lambs, things like that, you have what's called conjugated linolenic acid in the meats, which prevents certain inflammatory processes. You also have a lot less hormones or antibiotics that we found in the mass commercialized produced farmed animals. So choose your meats carefully. Wild game is quite good. Grass-fed meats or organic is also brilliant. And again, as much meat as you can handle in terms of small good portions that fulfill you. A lot of people struggle with the density of meat when you feel quite sick, but it's important to get just a little bit down. On the other hand, you may be going totally wild with meat. Too much meat causes a lot of damage in the system and can cause acidity. A little bit of meat can actually reverse acidity and strengthen the system. Another interesting diet is blood group. So I don't understand scientifically how certain blood groups can respond to certain types of diets. I don't. I know anecdotally that a lot of patients come through and say that the blood group works for them perfectly. It's hard to base things just on anecdotal evidence. So what I suggest is, if you're interested in blood group, find out your blood group, look at the diet, make sure there's enough roughage and fibers, make sure there's enough natural fats and proteins, and make sure that there is enough slow release carbohydrates to maintain you a good balance of foods. If you have that combination and it works for you, go for it. If it doesn't work for you, you'll understand very quickly that you don't feel as good as you would, or you find it to be too restrictive. Restrictive diets, again, cause stress, reduce calorie intake, and just make life a lot harder. So many people say it doesn't work, many people say it does work. If you're interested, try find out. Mediterranean diet. I like Mediterranean diet. A good combination of slow release carbohydrates with enough fiber and roughage. You have the right kinds of essential oils or fatty acids. You've got a good dose of protein in various forms. It's a good diet. They say that humans find it very difficult to digest certain milk proteins, and that can be quite pro-inflammatory. Many of us feel we have a certain milk allergy, not necessarily lactose intolerance, which is the one extreme of the spectrum, but we can feel certain stuffiness and bloatedness and things that react with milk. Sometimes we may not feel it, and there may be an inflammatory component. I generally recommend that if you're concerned about milk, avoid dairy products where possible. Almond milks and things like that may be more beneficial. Things like very mature cheddar cheese, we're talking 15 years plus, the nice nutty flavors, those have digested all the lactose in them and various other proteins that aren't an issue with allergies anymore. Certain types of cottage cheeses, for instance, are also quite good. Butter's not entirely ruled out in small doses, but generally the other milk products one can try stay away from. Any processed or refined carbohydrates that are white, your biscuits, your breads, your pastas, your sweet foods and subtypes of white rices, they tend to be fairly kilojoule restricted. They're nutritionally empty, don't contain that many vitamins, and many people have allergies towards them. If you're that person that loves pastas and you really feel good and settled and satiated afterwards, perfect. Stone ground flours, good whole wheat where possible. You can get good quality pastas. Go and find those. Good quality breads, whether it's spelt bread or whether it's stone ground flour and white bread, those are exceptions. Those are very nutrition filled and very low allergenic. When it comes to things like artificial flavorants or colorants, there is just too much research around the burden that it has on your system in terms of dealing with these additional heavy metals or toxins. They aren't cancer forming by themselves, nor are they going to cause the cancer to grow by themselves. But you want to give your body as clean a food as possible, something that is nurturing, nourishing, and pure. I think that in times we look at diet as being either restrictive, like we've mentioned, or therapeutic. And there comes a time when you need to change the view and say, I want to eat healthy to make me feel better, but I need to feed my body to help this therapeutic journey, to help the healing process. You might want to add MCT oil or coconut oil to various shakes that you have or to your food. That increases kilojoules substantially. You might want to add certain supplements or whey isolate protein that's easily digestible, or prebiotic fibers, or even certain probiotics. Certain fermented goods are absolutely brilliant. You can add that to the diet, but add them in a way that you enjoy them. Find the foods that you love eating. Eating is an important part of human existence. It's related to passion. It's related to emotions of feeling good. It's related to feeding the body with vital nutrients and building blocks. Diet is so important on so many levels, not just about a theory that it may treat cancer if you eat this kind of food. So explore the diet, find what works for you, what works for your body, what makes you feel good, something that you enjoy eating and looking forward to when you wake up in the morning. That's the right kind of diet.